Thank you for joining us right now on Facebook Live. I'm joined right now with Dr. Michelle Weiner, and we're talking about CBD and also medical marijuana. We're seeing a lot of people buying CBD now. It's a really big growing market. It's popping up at new places like beauty salons, even at the mall right now. But for a lot of people who might be tuning in right now who don't know what it is, what is CBD?
So CBD is one of the substances in the cannabis plant. And so cannabis and marijuana are the same thing. And it has over 400 substances. There's all these cannabinoids and terpenes. And so CBD is one of them that has a lot of medicinal benefits. And so now, because the Farm Bill passed, it's actually something that's looked at like a supplement. It has a lot of medicinal benefits for anxiety, inflammation, spasms, seizures, sleep. So the list goes on and on. A lot of people are now buying it on their own without even seeing a physician and starting to substitute the pharmaceuticals that they're taking by using CBD.
A lot of the benefits haven't been studied, but people claim there are a lot of them. I've talked to people who use it for depression, for anxiety, and basically the feds made it easier for people to buy and sell. So when it comes to CBD, how do people know what they're actually getting inside the product?
So that's a big problem because, like other supplements, it's not FDA approved. And so there's third-party lab testing that should be done, and there's different testing labs in Florida, actually. And so that tells you the cannabinoid profile, so it tells you how many milligrams of CBD and the other cannabinoids. It also should have less than 0.3% THC, which is a psychoactive one, and it tests for things like mold, pesticides. So it's important that the CBD company does this testing and gets a certificate of analysis to make sure that the patient's ingesting a product that is safe and also accurate based on the fact that they're paying for it with their own money.
Absolutely. And by the way, if you're joining us right now, feel free to comment in the comment section if you have any questions for Dr. Weiner. And if you're watching this once it's posted online, feel free to also ask your questions in the comment section. We'll answer those later. Dr. Weiner, we tested some samples ourselves. We had 35 samples, 5 of each of different products, 7 different products. We took them to a lab, and our results were pretty surprising. Half of the products had less than half of the amount of CBD advertised on the label, or no CBD at all. Does that surprise you, being a doctor who recommends CBD to some of your patients?
So if I didn't know about CBD and the cannabis industry, it would surprise me. However, they did the same type of study where they took hundreds of tinctures off the shelves over the West Coast in Oregon and California, and they found that 70% of them were mislabeled, which means they either have less than the amount of CBD that's stated on the actual label, or it may have more than even 0.3% THC, which means the patient may actually have that psychoactive effect. But for the most part, it's something where they're getting less than the product that they're actually paying for, which is really a shame to the patient. However, they may still get some benefit, but they're probably going to figure out maybe this doesn't work for me, and really it was just a product that didn't have any CBD in it.
That was a university study, and here are the similar findings with our study. People are buying this oil to take it, and come to find out it has up to 1/6 the amount of CBD inside. So they think they're buying this oil as a health benefit, but really, what is this, like a placebo effect where you think you're taking something, so you think you feel better, but really it's not doing anything at all?
Right, and actually the placebo effect is about 1/3 anyway, right? Like 30%. So a lot of people are ingesting, coconut oil or MCT oil, and they think they feel better, but it's really because they want to feel better, because a lot of people are at that point where they're on a lot of medications, they're in pain, they have inflammation, they're not sleeping for months, or maybe they're depressed or anxious and they want an answer. And so this is looked at like hope, but the thing is, it really does work if you're able to use a product that's reliable, that actually is accurate.
I want to get to some tips about what people should look out for when they're buying CBD products, but we're getting a lot of questions right now on Facebook. One person is asking, well, what's the best CBD oil to buy? That's a tough question to answer, right?
Well, right. So what's great about Florida is that medical marijuana is legal, and you can actually get a medical card and then buy CBD from a dispensary. And that means that you'll be able to use something that is lab tested. For sure, you know exactly it has the correct amount of milligrams. There's many different companies that are part of the hemp CBD, which means it has less than 0.3% THC, and you wouldn't need a marijuana card. For example, I use a company called Global Advanced Botanics. Botanicals. Green Roads is another great company that sells CBD. So these companies sell to pharmacies or different vape shops or even physician offices. But what's important is that you see that there is a certificate of analysis on their website, or that there's maybe a barcode on their tincture.
So if you have a medical marijuana license, you can go to a dispensary and you know exactly what you're getting. They know what farm it came from, and there's testing standards. If I were to buy CBD from a gas station, which I can do, there are a few down the street, you don't know what you're getting. So if you are buying something over the counter, you want to see test results, either online or in person, that show that that sample that you're buying has been tested and what was inside.
Right, but there's a step further. So that certificate of analysis may not actually match the tincture that you're getting. So that could have been a certificate of analysis that oil was received months ago, and they're showing that they've done that, but the actual batch that you're using may not be accurate. So that's the benefit of getting your medical marijuana card, even just to use CBD in the dispensary.
I've learned from doing a series of investigations on this that some of the companies have a batch number on it and a barcode, and you can actually use your cell phone to scan that barcode, and it'll take you directly to the results for that product that's in your hand. Is that something that you recommend, looking for that scan code on a product?
Yeah, I think if you're informed, you can take that next step. But I think what's exciting is that now in Florida, our Commissioner of Agriculture, Nikki Fried, is starting to move further with this, where they're trying to make Florida grow its own hemp and make guidelines for how that would be processed in Florida. So instead of us importing from other states, we would have guidelines how we grow it and we sell it within Florida. So that's something that is new, that's just starting to come up.
I got another question from Eloina Powers. She wonders if it helps with liver disease.
Well, I wouldn't say it's going to cure your liver disease, and you know, any type of supplement, we don't really say it cures or reverses anything. The benefit of CBD is that it's really not toxic to your liver or your kidneys. So people who are taking medications that have that side effect of disrupting one of their organs, CBD is very safe in that sense. It doesn't really have many side effects, but it is a great anti-inflammatory. So for a lot of chronic diseases, it can be used to treat multiple conditions.
One of the things I learned is that the FDA does not require any testing for CBD products, but they do send warning letters to companies that make health benefits. So if I'm a company and I say this product will help you sleep at night, or it could help with your medical condition, that's where the FDA cracks down on the companies. They can't say that.
Right. You can't say that it cures or treats anything, and you can only suggest that it may have some type of role in your health, but you can't actually indicate what that is.
Adrian Motzkin is asking, how do we know which product and how much dosage for that product is per serving? So if how do you know how much to take?
That's a great question. So most of the tinctures come in 30 milliliters or 1 ounce bottles. And so the milligrams on the outside on the label are actually the total milligrams in the tincture. So for example, if you have a 250 milligram tincture in a 30 milliliter bottle, a full dropper is about 8 milligrams. However, if you have a 1500 milligram tincture in a 30 milliliter,
I'm doing math here.
It's 50 milligrams. So you really have to know how many milligrams is on the label. That's the total in the bottle, and then you're dividing that really by the 30 milliliters. Okay, so it should say it on the serving size, but the bottom line is it's usually start low and go slow, meaning
start low, go slow.
Most people, we say start about 10 milligrams, and from there increase it every 2 or 3 days by a few milligrams until you're actually finding that effect. But some people get benefit from a very low dose, so it'll save you money in the long run to start at a lower dose.
Carol is asking us right now, I know the answer to this, can you buy CBD from dispensary without a medical marijuana card?
No, you can't go into a medical marijuana dispensary and purchase anything without a card. And in order to get a card, you have to have a chronic debilitating condition and then see a physician like myself who's taken a course that allows you to certify patients and put them on the medical marijuana use registry.
There are a lot of companies located in South Florida that actually make CBD as well, which I wasn't aware of, how big of an industry it is. And experts predict this is going to be a $5 billion industry by the end of this year. That's a huge, expansive growth for CBD. I think the bottom line here is we're going to be hearing a lot more about this, seeing it in a lot more places.
I agree. I always say that it'll probably be in our multivitamin. So it's something that has so much potential, so much use because of our endocannabinoid system, because of the science behind what it actually does to our body. And as we age, we're going to need it even more to prevent chronic disease.
Carlos right now is asking us, what is the average cost of CBD oil?
So it really can range anywhere from $40 to probably $100 180 depending on the milligrams. And again, besides just an oil in a tincture or a bottle that you use drops under the tongue, it can come in a capsule form, topical, or a vapor, an inhalation route. So there's many different ways of using it, but for the most part, I would say lower milligrams, like 250, can cost you about $45, and then 1,500 milligrams can run about 180. So it's always best, again, to start low and then increase slowly, because you may be able to get to that sweet spot, that therapeutic effect, with not many milligrams and not having to overdo it.
We tested 3 different brands, actually 4 different brands of gummies, because that's an also popular way to take it right now. They look like gummy bears, basically. And a lot of the gummies had way less the amount of CBD than was advertised on the package. In fact, one brand didn't have any CBD at all. Do you think there's something when it comes to gummies that it's difficult to get the ratio down if people are buying them?
Well, I think edibles in general, and we actually just met on Monday to discuss the rules for the medical marijuana dispensaries, how to prepare the edibles. The problem is having an equal ratio amongst everything. So if you're preparing a chocolate bar or, you know, a large amount of food in preparation, it's hard to make sure that you have an equal amount in each piece. And I think that an easier way of using a gummy is just to take the tincture of oil and put it into your own food. So it's already activated for you, that oil. So you can actually do it yourself, save a lot of money, and get an accurate amount of milligrams, and just put it into a spoonful of peanut butter or, you know, anything else that you're consuming. And this way it will actually last longer, and it will be much less expensive. And also you can avoid using the sugar that so many kids, for example, don't need because of the inflammation, and choosing a better choice for health reasons as well.
I wasn't being rude. I'm actually responding to viewers right now. Someone just asked, my 7-year-old daughter has seizures, and friends are suggesting to use CBD oil, but I'm afraid it's not safe.
So it's not safe if you are just buying it online or buying it off the street, especially for kids, I would say. First of all, anyone who has a condition should see a physician. So if your neurologist, for example, doesn't recommend CBD or medical marijuana, then you can work with myself or other doctors who, for example, will speak with your neurologist and go through this process. But it is something that can be helpful, but if you're on certain medications, you should also talk to your physician before starting CBD or medical marijuana. And it's something that for the most part has minimal side effects, but you may also start a product that may have no CBD in it, or may have, you know, lead or pesticides in it, and in that sense it may be harmful. So it's
getting
important.
A little direction will be good.
Right.
Getting a lot of comments now. Someone's asking if it helps for headaches.
It's great for headaches. So I have like a headache protocol where I usually have the patient using CBD every single day as more of a preventative. And then when they get a migraine, I use a combination of CBD and THC, and I usually register them, and they get that at the dispensary to abort the migraine. So it's very effective for migraines, which they actually think are now an endocannabinoid deficiency syndrome, which means you're not producing enough of your own. Of
your natural cannabinoids, and
right.
so this supplements it.
Right.
I sound like a doctor right now. I've learned a lot of
cannabinoids.
I've learned a lot over the last few months. I think a lot of people who are watching this probably have headaches. So
right.
if you were to talk to them right now and say, this is what you should do for headaches, if you have a legitimate product in front of you, oils, what would you do? Start low?
Yeah, start low. I would say start at 10, 15 milligrams every single day for
half of a dropper, basically?
Well, it depends, again, the milligram bottle, right? So if it's a 500 milligram bottle, that has about 15 milligrams in the dropper. So take a full dropper of that for about a week and see over time, do you have less intensity of that migraine or headache, or are you having less frequent headaches? And then from there, if there's no change, just slowly increase it. And usually I tell people if you're up to more than 50 milligrams of CBD, that's when we would consider sometimes entering in THC to see if that will save you a lot on the volume and also help you with a lot of your symptoms.
Sure. Here's a great question. Someone's asking if it's safe to use while breastfeeding.
So I think that almost no physician would actually say that during pregnancy we should use any cannabinoids, just because nobody's going to do a study on pregnant women. That, you know, that wouldn't be allowed, because God forbid anything were to happen to any of the children or infants, they would probably blame it on the cannabis. So I know that there's been studies looking at the use of cannabis in that postpartum time, and so I think that would be safe. You know, after you're no longer pregnant and you have a baby and you're dealing with some postpartum depression, I think that would be a safe time to use CBD. And I have a lot of people who use that instead of going back to their SSRIs and their antidepressants. I just think it's hard to actually do a study and say that legitimately there's enough evidence to state it's safe. But again, in our own breast milk are cannabinoids, so it makes a lot of sense that if you're using a good good product, you're actually enhancing what you're giving to your child. And there's also research showing that potentially the cannabinoids in our breast milk are what's most effective for why we like to breastfeed our children, for things that you're preventing in the future.
I see some people going back and forth about THC levels, and I think in case you're just joining us, I think a lot of people's first response is, oh, it's going to get you high. Do you think that's the biggest piece of misinformation about CBD?
Yeah, I think that they think about CBD as marijuana, and it's just one component. But more so, I think that they think that marijuana is just THC. And so you can actually use marijuana, and CBD is one of the components, and not have any of the THC, so you don't have any of the psychoactive effects. So even after I educate people, and now I say, okay, so we're going to start the CBD at this dose, they're like, well, I don't want to get high. I'm like, we just discussed this, right? So there really is no chance of getting high with just CBD. If anything, I say it's sort of this absence of anxiety, where we're not that familiar with that feeling, where we're actually just kind of relaxed. And so you're not really high, you're not dizzy, you're able to focus. Obviously, it doesn't cause that psychoactivity, but some people are still very nervous because it comes from the cannabis plant. So really the THC is what's given marijuana such a bad stigma. And it's just that one component.
A few people are asking, what is the best way to take it? Oil form, gummies?
So it has to do with the bioavailability. So actually, vaping anything has the highest bioavailability, which means it gets into our bloodstream in a high percentage, 30 to 40%. But the problem with vaping is it works quick, but it doesn't last long. So if you had acute pain or an anxiety attack, you can vape, and that will help you immediately, but it's only going to last about 3 hours. Usually the tinctures, sublingual, so putting the drops under the tongue and having your vascular mucosa take the medication up into your bloodstream is probably the most effective. It probably has about a 30% bioavailability, and also you can be very flexible with it and also put it in food. So someone who can't stay asleep a long period of time, I'll say put that same amount into food an hour before bed, and this way they'll stay asleep. Or vape in order to fall asleep, and then at the same time take it and put it in food. So I think it depends what you're trying to treat, if it's acute or chronic, but usually the tinctures, sublingual, are the best, but people don't like the taste, so that's why they put them into food.
A few people are asking, does it work well for arthritis?
Arthritis, easily. That's one that for sure, it's one of the best anti-inflammatories. Unlike non-steroidal anti-inflammatories, you're not going to get kidney disease or GI bleeds. So I think for arthritis, it's wonderful. If you had systemic arthritis in multiple places, you can use it again under the tongue. If you had an isolated area, you can even use a topical CBD to get rid of that knee pain or a specific joint.
Luis and Janet are asking me right now, does it help with anxiety?
Anxiety is another one. Anxiety is one of those that CBD alone would probably be beneficial without the THC. Sometimes people think they get more anxious because of using cannabis, and so they associate that with CBD. However, that's really more from a THC and even more of a sativa type of THC. So for anxiety, people do very well with low doses. They're able to substitute that for their benzodiazepines like Xanax and Klonopin. And again, you can treat it more acute or chronic. So you can vape it versus using it sublingual. A lot of people who are on an antidepressant, they'll start just taking a CBD capsule or CBD oil, and that'll last them the whole day. And then if they get anxious or have a panic attack, they'll vape the CBD.
This is a really good question. Joe just asked, will it be a problem for employment drug testing?
So that's a great question. Okay, so CBD as an isolate. So if it's just CBD, that is you won't be able to be positive for THC in your urine.
If the company's being legitimate and selling what's as advertised on the label,
right,
it should be fine.
Right. So that's a CBD isolate. So many companies, though, sell full spectrum or broad spectrum, which means it has other cannabinoids in it besides CBD, just less than 0.3% THC. But if you're using that over time, even though it's less than 0.3%, you still will be positive for THC. So then if your employer has a no THC policy, you can be fired even though we're in a legal state for medical. If you're using CBD in a dispensary, you for sure will be positive for THC because they have up to 0.8% THC. So if you are ever going to be drug tested, you would have to use a CBD isolate. And that, like for example, Green Road sells CBD isolates, and Global Advanced Botanicals, they have it too, but you would have to specifically ask for not the full spectrum.
So if I'm going into a store, I can buy a CBD isolate that basically isolates that one form of CBD to get the health benefits from it, the alleged health benefits. And if you want full spectrum that has a bunch of different types of chemicals or extracts from the marijuana plant. So if I'm worried about drug testing, I want a CBD isolate.
Right, and you just want to make sure it doesn't have the THC, because that's what we're testing for when we say you're positive for marijuana. It's the THC.
Okay, so those worried about drug testing, you want a CBD isolate, and you want to get it from a legitimate company that matches the lab test with what's on the label, actually. People are asking about different brands, but we don't want to have to promote anyone's brand over another. But someone's asking right now if it helps with sleeping.
It does. So CBD, one of the side effects I would say is if you take too much, you actually get a little sleepy. So a lot of people use a daytime dose that may be lower than their nighttime dose, and a lot of people are using it specifically for sleep to get off meds like Ambien. So I find, like, usually for sleep, I start people on 20 or 25 milligrams, a little bit of a higher dose, and that can be very effective. And again, whether you want to fall asleep or stay asleep depends on how you're taking it.
Someone's asking about Parkinson's. Does it help with Parkinson's?
So Parkinson's, I found that it depends what symptoms we're treating. So if you're treating anxiety or insomnia related to Parkinson's, then CBD is great. A lot of times when it comes to movement disorders or tremors or gait dysfunction, then adding a little bit of THC may be very effective. So sometimes the patient who has Parkinson's does actually get their medical marijuana card and uses a combination of CBD and THC for certain movement conditions.
Someone's asking me right now, and I'm not quite sure what it means, but a few people, they want to know the effects about you talked a little bit about the vaping of CBD oil, but they're wondering if it works just as good as if you take it orally, by mouth, I believe, is what they're trying to ask me.
So the difference is vaping, it only lasts for about 3 to 4 hours. So it's not a great way to medicate for a chronic condition. It's more to treat something that's happening momentarily. But the benefit of vaping, honestly, is that for the most part, you don't really know the dose you're getting, which is not great when you're talking about medicine, but at the same time, it's an easy way to fix the problem, because you inhale once, wait about 5 or 10 minutes. If you feel better, great. If you don't, you take another inhalation. So it's an easy way of trying to get to that appropriate symptom relief without having to titrate up and wait multiple days. People who get frustrated sometimes just go to vaping, and they figure out what ratio in milligrams they need and how many they need to inhale at one time. Someone's
asking right now how easy it is to find a CBD isolate. Are those common if you're worried about drug testing?
Yeah, if you find a good company, like I've said before, there's a few good companies that I always use. They have isolates, but you would specifically have to ask for that, and it will say THC free.
When we did our testing, we tested about 35 products, and if you're looking for that story, you can find it at NBC6.com. One of the things we also found in some of our samples were high levels in one of the products, pesticides, and another one of the products we found fungus. Why could that be concerning if you're consuming this product?
That's a good question. So a lot of cancer patients who are immunosuppressed, patients who are on dialysis, you don't want to enter any new pathogens, any viruses, any bacteria into their body. So that's why we don't smoke it recreationally, because you are not testing it, and there can be different types of fungus or different types of pathogens on the flower itself. So that's one danger if you're dealing with someone who is, let's say, going through chemo. You want to make sure that it's being tested, and that's again the benefit of getting your medical marijuana card, where all of those things have been tested for you, so you're not guessing and you're not hoping. There was a story in California. Now a lot of the cartridges are leaking lead, and so they're trying to figure out a way to use it in an inhalation route without getting lead into your lungs.
So basically, we have a lot of questions here. We're also running out of time. So if you have any more questions, feel free to ask them in the comment portion here, and we will answer them at a later time. So keep an eye out for that. The bottom line here is pay attention to the products that you're buying. Make sure you buy from a legitimate company that does lab testing, and try to look at those lab results if you can. But I guess asking questions would be the first way to start that conversation with someone you're buying it from. See if they know the answers.
Right, and not just to trust what looks pretty, basically. That's how a lot of people buy things, as opposed to making sure it has that certificate of analysis, or they're talking to a physician who knows the industry, or a company that's been around for a while that has a good reputation.
And any questions, of course, ask your doctor.
Sure.
All right, thank you so much, Dr. Weiner, for joining us. We really appreciate it.
Thank you.
And thank you for asking all of your questions. If you have any more questions, again, leave them in the comment portion, and we will answer them as soon as we can.